Well, hi and welcome everybody to the European Webinar Series. My name is Susanne Mattsson, and I'm a lecturer and researcher at the Department of Women's and Children's Health at Uppsala University. And today I will talk about indicators of domestic violence with my colleague. Apart from being a researcher and a lecturer, I also work clinically with the psychological treatment for women subjected to domestic violence and sexual assaults. So that's my background on this topic. Yes, and Hadil?
Yeah, hi everyone. My name is Hadil Zainal Kamil, and I work as a lecturer at the National Center for about men's violence against women in Uppsala University here in Sweden. And prior to that, I've been, among other, been working with women who've been experiencing violence in shelter houses. Happy to have you here.
Yes, and the outline to today's presentation is that we will start by going through the role of medical professionals in identifying domestic violence, and then we will move on to signs of unhealthy relationships. And we will also go through impacts of domestic violence, and then possible indicators of sexual, physical, and psychological violence. And then we will end with biases in the context of domestic violence and their consequences. And after the presentation, there will be a Q&A session. So the chat will be turned off during the presentation, but you will be able to ask questions in the Q&A function also during the presentation, but we will respond to them in the end in the Q&A session. Yes, so the role of medical professionals in identifying domestic violence. Victims of domestic violence may not always want to report domestic violence. Actually, it's quite common that they don't, especially to the police. And it can also be very difficult to speak to a counselor or turn to an NGO and so on. So the dark field related to domestic violence is quite high. But victims, when they definitely need help because of injuries or due to long-term health consequences as a result of domestic violence that requires medical treatment, may finally have to see a physician. And in addition, due to other non-domestic violence related visits, they may seek the medical sector, for example, control appointments at the dentist or diabetes management, skin cancer screening, and so on. So they do have doctor's appointments more frequently. And at this point, their physician or dentist might detect signs of domestic violence, although it was not intended by the victims. So because of this, healthcare professionals are often the first, beside friends and family, who either hear about the presence of domestic violence, or they may be the first ones recognizing the indicators and symptoms pointing towards domestic violence. So therefore, it's crucial that healthcare professionals know about the signs, how to identify domestic violence, and how to ask the questions to enable the patients to enclose this sensitive topic. And there is a dispute regarding whether to ask about domestic violence based on indications versus routinely. And it's important to be aware of the fact that individuals that have been subjected to domestic violence rarely disclose easily or by themselves. So therefore, it's important that health professionals help the patient disclose. And things to consider when asking about domestic violence is to always ask about the violence in private, as it is not clear who the perpetrator is, hence can be the person visiting the clinic with the victim, and then also, of course, to protect the victims, the patient's integrity, as we always do in healthcare. But yeah, it's of major importance to ask in private. And then to also take the person's story seriously. Questions regarding the experiences of violence can be both open and targeted. And it's important to know that the things that patients sometimes disclose can be pretty heavy information and sometimes much worse than what you expect. So it's important to take the person's story seriously. And then to also consider the words that you use. Depending on which patient you meet, you might need to adopt the language and so on. And then listen carefully and ask questions before making assumptions. I will talk about it later in the presentations, but we do have a lot of ideas on a typical victim and a typical perpetrator, and it's important to ask questions to find out the details that you need to find out in order to make any assumption on the situation. And then to also allow the process to take time. This is a sensitive topic and it's difficult to disclose. And my experience from working therapeutically with women subjected to domestic violence is that especially sexual violence, that is a common factor within relationships that where there are other forms of violence, is the threshold for disclosing this kind of violence is even harder. So yeah, it's important to let the process take time. And then to always use a professional interpreter, due to the fact that it could, if there's a relative that visits the hospital, for example, with the patient, that can be the perpetrator, but then also due to the importance of that the information that the patient is disclosing comes out right and reaches the professionals in an adequate way, so that we can offer adequate support. There are some factors that can help the patient to share, and one of these factors can be to define what the violence is. It's not uncommon that victims subjected to psychological violence, for example, where there's a lack of physical violence, sometimes it's hard for them to identify the violence as domestic violence, since there are ideas on physical violence, and that there's a need for physical violence in order to call it domestic violence, which is not true, of course. So sometimes you need to define what violence is when to help the patient disclose. And then to also explain why you are asking. And it's a good thing to explain that this is a global health issue, and it's not too uncommon. So it's a good idea to say that it's a question that we usually ask in order to make it less stigmatic for the patient. And then to also explain what will happen if the patient share, what kind of support that the patient can be offered, counseling, protection, and so on. And then to also, of course, explain confidentiality, that the thing that the patient disclose will stay within the healthcare system. And to also explain mandatory reporting when there's an obligation to actually report, as for example, when children are involved, witnessing or experiencing the violence. And then to also show knowledge and respect and trust. It's very important to have knowledge on the mechanisms, on the signs, and how to ask questions. And research show that the main obstacle for asking questions, asking patients about domestic violence, is a lack of knowledge. And it's also important in order to build an alliance and trust and enable disclosure, that you have the knowledge, that you meet the patient with respect and enable trust and alliance. And then to also adapt the environment, of course, assess the risk. Maybe the perpetrator is with the patient at the hospital. So it's important to make sure that you can talk to the patient in private and make sure that you can do it without causing a bigger risk for the patient while doing that. And there are some signs that should be given special attention. And that is when the stated cause does not match the appearance of the injury. As for example, if there's an injury that the patient explains in a way that doesn't make sense, then you should dig a little deeper and pay extra attention to that. And then previous visits with unclear injury patterns, that can also be a reason to dig a little deeper and ask questions on what the reason is and what it is that is happening. And then repeated visits for vague complaints. Sometimes the long-term effects of domestic violence can be quite vague, and it can be difficult for both the victim and health professionals to refer the symptoms to the domestic violence. So therefore, it's very important to ask questions when there's a discrepancy between what the patients say and what you observe, and when things are unclear, you cannot really get a clear picture on the problem. And then also delaying seeking medical care, that can be a sign of a living situation where the patient doesn't have room or possibilities to go and visit a hospital. It could be a result of being controlled at home and so on. And then, of course, if there's a partner that is overly protective and controlling and refuses to leave the patient alone at the hospital, that is something, of course, that we need to react on. And reactions to domestic violence and threats can be difficulties undergoing gynecological examinations, and this can be a trauma response due to various kinds of violence, but also, of course, a response to sexual violence. And then also fear of childbirth, and difficulties undergoing rectal examination. This can also be a consequence of sexual violence, but also a trauma response on various kinds of violence. And unusually strong reactions to examination of the mouth and throat, that can also be a sign of various kinds of violence. And an inability to be in confined spaces, as for example in a CT scan. And this can also be due to various forms of violence, but it can be a result of strangulation and but various forms of violence, a trauma response that makes it difficult to be in confined spaces in general.
Okay, and now you heard some signs of, or more specifically, some indicators, and I will continue on that, but before that, give you some more in-depth signs of unhealthy relationships. Before doing that, I would just like to raise something of note. Research shows that women are more likely than men to experience severe, repeated, and controlling violence from a partner. Compared to men, women are also more likely to experience sexual violence in intimate partner relationships. However, women, men, and non-binary people can be victims of domestic violence. They can also be perpetrators. So domestic violence occurs in all types of relationships between intimate partners, regardless of sexual orientation, gender, and/or gender identity. So no two relationships are the same, and neither are relationships where violence is present, but there are some patterns in violent relationships, and these often includes the following. We have ignorance, when a person uses his or her or their own anger as a pretext to punish another person by deliberately ignoring him or her or they. That is target ignorance. People can express, as we know, their anger in different ways. However, if it's consciously directed towards another person in order to make him or her feel anxious, sad, or attacked, it can be a warning sign of violence in a relationship. Another sign is blackmail, when a person threatens to leave another person or to reveal some secrets that one doesn't want to be shared. And the threat to reveal these secrets is used when the partner refuses to do something. And in a healthy relationship, blackmail is never used as to threaten the partner to achieve a certain goal. We have humiliation, when a person insults another person to make the other one feel guilty. And this is something that is not visible in healthy relationships. There's never ever a good reason in healthy relationships to belittle one's partner, to make them feel sad or anxious. Manipulation is another sign, when a person deliberately influences the feelings of another to make that person act or feel in a certain way. So the use of manipulative tactics to control someone's behavior, feelings, can be a sign of domestic violence. Another sign is extreme jealousy. Typical jealousy is fleeting sensation that arise suddenly and can typically be managed independently by the person himself or herself. But when it comes to extreme jealousy or unhealthy jealousy, on the other hand, it occurs when someone reacts impulsively or due to suspicion or insecurity. And control is actually one of the main, or the sign that is often talked about when looking into domestic violence. Control can be demonstrated in various ways. It can, for example, be when a person control another person's clothes, where he or she is allowed to go, and at what time the person should be at home, for example. In a healthy relationship, however, it's normal that the opinions of both parts is equally relevant. And this is not the sake when we talk about unhealthy relationships. Intrusion into private life, and this is something that has been more and more researched on because of the technology and the progress in technology. For example, when a person asks another person to read his or her private messages, demands passwords, which causes distress and make the partner, the one who's abused, feel uncomfortable. And that is an intrusion into one's private life in order to control or intimidate him or her. And then we have isolation, and that is also something that is well researched on and also well raised and addressed when we talk about, specifically addressed when we talk about domestic violence. Isolation and control is those who are mainly addressed when we talk about domestic violence. And isolation is, for example, when a person aims to sever all connections between, control all connections between another person, or severe or make it smaller to his or her friends and family, which can be a sign of domestic violence, even if the perpetrator claims that it's done out of love or meaning. It means well. And then we have intimidation, when a person intimidates another person so much that person is always afraid to stand up for him or herself, their self. Sometimes those affected by it can be in unhealthy relationships. Intimidation is often used to frighten and control someone else. And when we talk about domestic violence, all of these signs are more or less visible. But again, all relationships are different, but we can see patterns. Often these are part of that the abusive relationship. So while each individual will experience domestic violence differently, there are many common consequences of living in an environment with violence or living in fear. Often the short and long-term physical, emotional, and psychological or financial and other effects on the individual quite similar. So even when we look at impacts, we can see patterns. And being exposed to violence can contribute to an increased risk of various forms of mental and physical health problems, both in the short and long term. And this is important to understand the effects. It's important to understand the effects of domestic violence on victims, because those effects are responsible for many indicators that I will show you soon. Before doing that, I will also want to raise a category of people that is often forgotten about, the society's most vulnerable, and that is children. And it's important here to recognize that when we talk about children in the context of domestic violence, it is not a question of children witnessing domestic violence, but rather experiencing that. And this change of wording can help one to remember that violence also affects children, both in short term and in long term. And a somewhat older but still helpful literature review concerning the impact of domestic violence regarding children and the health impact. In that review, they found that impacts on children exposed to violence can be explored in 4 different domains. They are interrelated areas, as you can see the ones in the brackets here on the picture, but they are all researched on. And the study showed that children are at increased risk of experiencing abuse and of developing emotional and behavior problems, and of increased exposure to the presence of other hardships in their lives. So this study is advocating for a child-centered holistic approach, which is grown out from an informing the child, and also capturing knowledge and information from the individual child's own experience. So be open to their individual needs, and looking closer at how children react to abuse. Other studies have shown that the impact varies a bit depending on the child's age. For example, infants exposed to domestic violence often show higher rates of poor health, disrupted sleep patterns, a lot of crying, and also disruption in forming healthy attachment with other people. Going and looking at preschool children, typical these category of children display more behavioral disturbance, such as bedwetting, sleep, like having trouble sleeping, or other sleep issues, and eating challenges. Studies show that they are also more likely to blame themselves for the violence they see at home. And finally, when it comes to the older children and teenagers, they are more likely to demonstrate the effects of the violence in their lives through some research calls it education sabotage, like academic underachievement or limited social connection or self-harm even. So it varies according to some studies. Looking at it varies and depends on the age when wanting to look more into the impacts of domestic violence. And there are other studies showing that people who have experienced challenging or traumatic experiences in their childhood are more likely to exhibit both physical and mental or cognitive harms in getting older. And you can see in the VIPROM training platform model 2, you can find examples of long-term impacts of children related to long-term impacts of domestic violence related to children. So another note to take home is every victim is different, and the individual and the cumulative impact of each act of violence depends on many complex factors. age is only one factor. And given the short and long-lasting negative impact on individuals living in an environment where domestic violence occurs, and given that most people who have been experiencing or experiences today domestic violence, they won't share it, or if they do, they don't often share it to professionals, hence making it really important for outsiders and specifically professionals don't look away. And so domestic violence is a societal issue and should not be viewed as a private matter. We know that it leads to both physical and mental health issues, even increases healthcare costs and burden, of course, social service and other social agencies. So addressing domestic violence requires collective action, of course. And looking in healthcare and even social care settings, professionals may have obligation when it comes to, at least in Sweden, where we are at right now, when witnessing or getting some sort of sign that a child is living in abusive home, that the healthcare professionals are obligated to report that to the authorities. However, this obligation varies, of course, across countries. And there is also a clash between the obligation to report the issue of violence and the patient-client relationship, the fear of, in some sort, the fear of harming that relationship versus the obligation to report. There is some clash between those. In any way, there is one way to address that is understand both the impacts of violence when it comes to health or ill health, but also understanding and knowing of signs of domestic violence. I think that can make you more prepared to maybe report or at least do something in that situation. And there are a lot of indicators that can serve as red flags. Susanne, my colleague, she mentioned some of them, and I will go through, give you more examples. But again, it's important that healthcare professionals remain alert to potential signs and respond appropriately, because not all signs or not all indicators of violence are visible. Sometimes and many times they are quite subtle. We know from research that some victims drop hints in their interaction with healthcare staff. They can give things away without saying something verbally. It can also be a matter of how they behave. The behavior can be telling as well. What we also know is that victims rely on healthcare professionals to listen, to persist, and inquire signs and cues, like inquire about signs and cues. They need to, I think that is good information to have, that there is a trust between the patients and the healthcare professionals. By going into the signs and starting off with possible health and behavior indicators, there are some you have in the image here, but again, there are many more on the VIPROM training platform. And although these can be indicators of domestic violence, they can also be, of course, indicators of other issues. But let's just quickly go through them, starting with the image here is presenting some health and general health and behavior signs of domestic violence. So we have, for example, chronic conditions, including headaches, pain and aches in muscles or joints, and back. And these are some signs. It can also be having difficulty to eat or sleep, heart symptoms without any evidence of cardiac diseases. It can also be patients who are restless, nervous, or have or fear or scared. Sorry. When it comes to being examined, for example, especially in connection with vaginal examination, it's an indicator that is especially important to be aware of. A sign especially important to be aware of. Another behavior indicator could be frequent hospital or clinic visits, especially when it's about having varied or unexplainable injuries or symptoms. But it can also be missing appointments or being not showing up at all, or just changing the time for appointment. And looking more in depth to different indicators connected to different forms of violence, I will start with physical violence. Possible indicators of physical violence has been identified as, for example, injuries to the reproductive organs, acute fractures, subacute or temporary fractures, soft tissue injuries, and so on. And looking more into the psychological or mental abuse, some possible indicators of these type of violence can be emotional distress, for example, feeling anxious, indecisive, confused, or being hostile. It can also be psychosomatic complaints, such as having chest pains, again, headaches, dizziness, muscle tension, jaw clenching, stomach or digestive problems, or changes in appetite. And another possible indicator of psychological violence may be self-harm, so even suicide attempts. When it comes to sexual violence, you have different possible indicators there as well. For example, common infections in the genital area, pain in the lower abdomen, sexual STIs, or bleeding in the vaginal or rectal areas, pain when urinating, strong fears of examination in the genital area, or even patients avoid to be examined. Or sexual problems such as fear of intimacy. Again, these are only examples, possible indicators of sexual, and then before that you saw physical and psychological. So indicators of sexual violence can also be self-harming behavior, as it's an indicator of psychological violence. Injuries to the body can also be indicators of physical and sexual violence, especially if it's injuries to the genitals. And since there are many signs of domestic violence, it could be a good idea for the healthcare professionals aiming to always ask about DV when taking medical history. So that was a long list of indicators. Do you want to find more indicators? There are more on our platform, the VIPROM training platform, module 2.
So welcome back, everyone. We have to continue, and I will rush through this a little bit, even though this is a very important part of this presentation, but also of the topic when it comes to indicators of domestic violence. So the question about biases and stereotypes has been raised much more, both in the political debate, but also in research, which is very good. And at the VIPROM platform, we have a whole module that raises this topic that has to do with biases and stereotypes in the context of domestic violence. So please visit module 8 and take part of the very important and valuable knowledge that we have in this module. Yes, so biases in the context of domestic violence. It's important to know that individuals from diverse cultural backgrounds may manifest their symptoms differently, but not necessarily. So it's important to remain conscious of our own perspectives, our biases and stereotypes when we are communicating with the potential victim, as these factors can impact how we assess the symptoms. There are a few groups that has been especially subjected to discrimination and so on due to biases and stereotypes. The LGBTQ group is one of these groups. And historically, media has largely ignored the existence of LGBTQ, and the majority of content that has featured the experiences of LGBTQ has been full of outdated stereotypes and has painted them either as victims or mentally ill, which has contributed to the discrimination directed towards people in this group. And there's a movie, Disclosure, Trans Lives on Screen, that showcases the contributions of the trans community to media and the history of transgender representation in cinema and television, while also analyzing the impact of these depictions on the well-being of transgender people in our society. And I strongly recommend you to take part of this film. You can find it at YouTube. And it's important to have in mind that misrepresentation and biases about LGBTQ individuals can have a profound impact on their ability to seek support in cases of violence within intimate relationships. Since when society holds a skewed or stereotypical view on LGBTQ people, it often fails to recognize forms of abuse that they may face, leading to a lack of appropriate support and resources. So these biases not only make it harder for LGBTQ individuals to access help, but also contribute to the normalization of violence within their relationship, as their experiences are often dismissed or misunderstood. So this is important to be aware of. And we do have a lot of stereotypes and biases when it comes to both victims and perpetrators, and also the signs on domestic violence. Nils Christie was a Norwegian sociologist and criminologist who coined the term the ideal victim in 1986 already, showing that we attribute more credibility to victims who possess certain characteristics. And the theory is based on 6 different characteristics that determine whether individuals or groups gain legitimate status as victims. And he argued that it is society that creates social constructions of who gets this status. And this means that even if an individual or group is defined by society as a victim, it does not necessarily mean that the individual or group themselves define themselves as victim of crime, and vice versa. So, for example, a woman who is subjected to violence may resist in various ways, but still be seriously exposed to violence. And this can be misinterpreted based on his research, which shows that the ideal victim should behave and have certain characteristics. So first of all, he found that the victim should be weak in order to gain credibility. We don't have the typical picture of a strong and loud and angry victim, which may be the case due to the resistance that can be the result of have been subjected to violence. So this is important to have in mind. And then also, there are ideas that the victim should be engaged in a respectable project. We all know that when it comes to rape cases and so on, it hasn't been uncommon that the victim has been subjected to questions on the clothes she was wearing during the attack and so on. And also that the victim should be in a legitimate place, which could be a woman walking home in the evening by herself and then is attacked by a stranger, which is not the the common story, because it's much more common that the victim is attacked in her own home. And when it comes to sexual crimes, it usually happens by a partner. That's much more common in her own home. And then also, there are also biases about the perpetrator, that the perpetrator should be large and evil and angry and loud and so on. And it doesn't have to be like that at all. It can be the opposite, that it's a very nice person, a very socially, nice person. That is hard to imagine that this can be a perpetrator. And then we typically also assume that the perpetrator should be unknown to the victim, which is a stereotype that is quite far from reality, since it's much more common that it is a partner. So some important take-home points when it comes to biases is that unconscious biases can occur due to information overload, low informative value, and also a need for quick decisions. It's a way for us to navigate through life. It wouldn't work if we had to think things through before every decision that we make. And then also the diversity of information. There's a load of information coming in all the time. And we have to sort of choose what to believe in. And we're prone to believe the things that resembles our latest experience, for example, that we have taken part of in media and so on. And these biases, they are like shortcuts that our brains, especially when we are feeling stressed or scared, go to, which is not very uncommon in a busy healthcare environment, that we're stressed and we have to act quickly. So we need to be aware of this. And sometimes these shortcuts can cause unfair treatments or discrimination. So it is very important to understand our own unconscious biases. We all have them, and we're extra prone to act on them when we're stressed and so on. And to address unconscious biases, we should question our perceptions and reevaluate our experiences regularly. The only way for us to handle our stereotypes and biases that we all have is to have a perspective on ourselves. What are my stereotypes? What kind of biases do I walk around with? And to always keep that in mind when you meet a patient. Yes, and this is quite on time. We will now move on to the Q&A session. So this is the end of the presentation.